Hi, Dr. Friends. Today's topic is about the drug of choice. The starting with a drug of choice, I have previously uploaded the drug of choice. There is next the drug of choice, which are commonly asked in medical PG exam. So it is important and make a list so that you can remember and retain it. Let us start. Here the alcohol dependence. The alcohol dependence withdrawal symptom including seizure, then benzodiazepine like chlordiazepoxide or diazepam is the drug of choice. This is the drug of choice. The maintenance therapy, that means for the dependence removal, the chlordiazepoxide will be the drug of choice. And to prevent craving, naltrexone will be the drug of choice. The question asks about the alcohol withdrawal symptom. Most commonly, withdrawal symptom will be the tremor. So you have to remember the withdrawal symptom and the withdrawal symptom including seizure. Then benzodiazepine and next one is the methanol poisoning. Then methanol poisoning, the drug of choice will be the fomepizole, or next is the ethyl alcohol. That means ethyl alcohol. You can make it remember by fomepizole. That means fomepizole. Pine for the drinking purpose, and the Hindi is pina. Next one is the ethylene glycol. Ethylene glycol poisoning. The drug of choice also will be the fomepizole. The anxiety disorder. Anxiety disorder, here the performance anxiety. Then the drug of choice will be the propranolol. And the generalized anxiety disorder, in which the acute attack will occur, then benzodiazepine will be the drug of choice. Sustained treatment. Sustained treatment, then the antidepressant like the venlafaxine and or duloxetine will be the drug of choice. In the panic disorder, acute panic attack, the benzodiazepine will be the drug of choice, and sustained panic disorder, then sertraline will be the drug of choice. Sertraline. In case of insomnia, zolpidem will be the drug of choice. The drug of choice, most important thing is for the seizure or epilepsy. Then maximum seizure, the valproate will be the drug of choice. Let us start with the which drug will be the drug of choice in case of different type of the epilepsy. Start with the grand mal. Also ask that what is the grand mal. It is the GTCS, generalized tonic-clonic seizure, is known as grand mal. You can remember it by the GG. Then GV. Okay. Next is the petit mal, also known as the absence seizure, or the drug of choice will be the valproate. The focal or partial seizure, the carbamazepine or oxcarbamazepine will be the drug of choice. The drug of choice, how can you remember? The first I have told the G grant, and GB is the trick. Mnemonics to remember. Petit mal, absence seizure. Petit, you can also remember PV. You also know as the PV examination, so you can remember PV. The focal or partial seizure, the carbamazepine, that means the you can remember it by the first car. So focal seizure, the drug of choice will be the carbamazepine, and partial PARCAR. So you can remember it ARAR. The myoclonic seizure, the valproate will be the drug of choice. Atonic and tonic, the valproate will be the drug of choice. Atonic, tonic, petit, grand mal, all will be the drug of choice will be the valproate. The infantile seizure, in case of infantile seizure with the tuberous sclerosis, then the drug of choice will be the vigabatrin. And infantile seizure without tuberous sclerosis, also known as the West syndrome, the ACTH will be the drug of choice. So you can remember it by the TS, that means tuberous sclerosis, and here the TH is the ACTH. Here the TH is the trick. The febrile seizure, the diazepam will be the drug of choice, and status epilepticus, the lorazepam will be the drug of choice, and the eclamptic seizure, the magnesium sulfate will be the drug of choice, and epilepsy in the pregnancy, then lamotrigine, topiramate, or levetiracetam will be the drug of choice. In the PG question, it is many times repeated, epilepsy in the pregnancy. So don't be confused about the eclamptic seizure or epilepsy in the pregnancy. If the question will ask about what is the drug of choice for the female of eclampsia, then magnesium sulfate will be the drug of choice. And if the question asking about the epilepsy in the pregnancy, that means lamotrigine, topiramate, and levetiracetam will be the drug of choice. Next one is the Lennox-Gastaut syndrome. The valproate, rufinamide, clonazepam will be the drug of choice. Anyone. If the neurodoc asks, then it will be the rufinamide will be the drug of choice. The juvenile myoclonic epilepsy seizure. Then here the myoclonic word is present. Then you have to always remember in case of valproate, the seizure will be myoclonic, clonic, atonic, seizure, then valproate will be the drug of choice. Even if the juvenile word is used, valproate will be the drug of choice. Rolandic seizure or the benign epilepsy of childhood, the carbamazepine will be the drug of choice. In case of the neonatal seizure, the phenobarbital will be the drug of choice. And in case of mesial temporal lobe epilepsy, then the surgery will be the drug of choice. That means it is not drug of choice, it will be the surgery of choice. Next one is the neuropathic pain. Neuropathic pain, that means trigeminal neuralgia, post-herpetic neuralgia, and diabetic nephropathic pain. In case of trigeminal neuralgia, the carbamazepine will be the drug of choice, while that of in post-herpetic neuralgia, the pregabalin or gabapentin will be the drug of choice. This is also in the diabetic neuropathic pain. Pregabalin and gabapentin will be the drug of choice. In case of the Parkinsonism, the early drug of choice will be the pramipexole and or ropinirole. In late case, also the pramipexole and ropinirole will be the drug of choice. Drug-induced Parkinsonism, then benzoxazole or anticholinergic drug of choice. Next one is the levodopa-induced vomiting, then domperidone will be the drug of choice. And the psychosis, then olanzapine, atypical antipsychotic will be the drug of choice. Next one is the schizophrenia. Schizophrenia, the most commonly asked question about that schizophrenia. Then drug of choice for the schizophrenia will be the olanzapine, and in non-compliant patient, the risperidone drug of choice. This is the long-acting drug of choice. And in case of the refractory, the clozapine will be the drug of choice. Clozapine, refractory. If you know the definition of the refractory period, then the refractory period is the if first stimulus is going through when it completed the action potential, then a gap between them where no any stimulus can tax a action potential. So that means you may ask the close the action potential aggression. So refractory schizophrenia, you can make it by metric or urontric. Refractory, that means close. Refractory close, that is clozapine will be the drug of choice. In the resistance case, schizophrenia without positive case symptom, then also the clozapine will be the drug of choice. Here the word is without used. If with use, with positive case symptom, then chlorpromazine will be the drug of choice. In case of chronic schizophrenia, then the flufenazine ibutoport will be the drug of choice. Next is the manic disorder. In manic disorder, the acute case, the benzodiazepine or olanzapine plus lithium will be the drug of choice. Here the acute mania case, while that of for prophylaxis, lithium will be the drug of choice. Bipolar, also lithium. Rapid cycle, valproate will be the drug of choice. Next one is the Gilles-de-la-Tourette syndrome. The haloperidol will be the drug of choice, FDA approved, and clonidine, guanfacine, it will be the also will be the drug of choice. In case of multiple sclerosis, RRMS, the beta interferon will be the drug of choice. The Huntington chorea, the tetrabenazine will be the drug of choice. In case of Wilson disease, the zinc will be the drug of choice. In the depression case, the mild to moderate, the fluoxetine will be the drug of choice. In case of severe depression, the venlafaxine will be the drug of choice. Neurotic disorder. Here in case of OCD, obsessive compulsive disorder, the fluoxetine will be the drug of choice. In case of the post-traumatic stress disorder, sertraline will be the drug of choice. In bulimia, the fluoxetine will be the drug of choice. In case of the phobia, sertraline will be the drug of choice. Impulse control disorder, the fluoxetine will be the drug of choice. You can remember it by the only two, post-traumatic and the phobia. The drug of choice will be the sertraline. So you have to remember post and phobia, sertraline. Next one is the fluoxetine will be the drug of choice. Next one is the attention deficit hyperkinetic disorder. The methylphenidate will be the drug of choice. In nocturnal enuresis, the desmopressin will be the drug of choice. In case of the severe pain, like cancer pain, the opioid morphine will be the drug of choice. Neuroleptic analgesia, the droperidol plus fentanyl will be the drug of choice. Neuroleptic anesthesia, the droperidol, fentanyl and N2O, nitrous oxide, will be the drug of choice. Opioid poisoning, then in case of opioid poisoning and maintenance, the drug of choice will be the naloxone will be the drug of choice for opioid poisoning or acute attack. Naltrexone for the maintenance. Next one is the opioid de-addiction. Here the question asking by different way, so you have to remember such type of question. The opioid de-addiction, in case of maintenance, the methadone will be the drug of choice, while that to prevent the relapse, naltrexone will be the drug of choice. To treat withdrawal symptom, beta blocker or clonidine will be the drug of choice. Alzheimer's dementia. Here the Alzheimer's dementia, D. Here the donepezil will be the drug of choice. Amyotrophic lateral sclerosis, Riluzole will be the drug of choice. Here the extrapyramidal symptom, the acute muscular dystonia, the benzaxol will be the drug of choice. In case of the akathisia, the propranolol will be the drug of choice. The neuroleptic malignant syndrome, the dantrolene will be the drug of choice. Tardive dyskinesia, no treatment. And here the drug of choice, so no treatment, while that of in case of benzodiazepines may be helpful for tardive dyskinesia. Restless leg syndrome, the pramipexole will be the drug of choice. Thanks friends, have a nice day. If you like my video, then subscribe, like and press bell icon for latest update of my video. If any queries about my video or suggestion, please write in my comments box. Thanks for watching my video. Have a nice day again.